All right, quick COVID update. We've got some CDC guidance. We've got a couple of papers that have come out, so we should go over these one. And obviously the big one is the CDC guidance around vaccinated people. This is obviously a big deal because increasingly here in the United States, we have a lot of people that are getting vaccinated. Last Saturday, they vaccinated 3 million people. That's where we're trying to get to the 3 to 5 to even up to the 10 million people vaccinated per day as the Johnson & Johnson vaccine comes along. And as they've fixed a lot of problems with the Moderna and the Pfizer vaccine, we're going to get a lot of this out. And we've been told by the White House that they will have enough vaccine for everybody by the end of May. It's amazing if that happens. So if you, or first of all, what is fully vaccinated mean? Fully vaccinated means, according to the CDC, remember that the CDC is very conservative here. They're saying it's 2 weeks after the second dose of your vaccine, whether it's Pfizer or Moderna, or 2 weeks after the single dose of the Johnson & Johnson. If it's less than 2 weeks since your second dose or your one dose of Johnson & Johnson, they say you should still follow all of the same protective measures. But you and I know that even 10 days to 14 days after your first dose, you are extremely protected. This second dose probably does more for your long-term immunity than it does for your short-term immunity. But this is the CDC guideline. So what does that mean for people getting back together? Well, we're already starting to practice this here in the studio, and lots of docs around the country are doing this. If you're in a vaccinated household, if everybody in the house is vaccinated, off with the masks, back to your normal life. Because your chance of getting the disease is really, really low. Your chance of getting really sick from the disease is essentially zero. Your chance of spreading it to another person gets pretty low as well. So they've even suggested, like, if you've got a vaccinated household, but there's another unvaccinated household over here, maybe a friend or a relative that you hang out with all the time, you can also just say, we're all good here. We can be inside together and we can not wear masks. That's just for one other single household. You can't do that with 50 households because that statistically means that at some point you might be able to infect somebody or get infected. But for small groups now, where you've got a vaccinated group and a small group of unvaccinated people, like two single households, it's okay for you to get together and to not mask. So this is a huge deal for a lot of people. So now for fully vaccinated people, you should continue to also take precautions when you're in public. So when you're outside, there is the small chance that you could have it and give it to other people, so they're still asking you to wear masks. There's still the small chance you could get it from all of those people that are unvaccinated, so they're saying, you should wear a mask because that can also reduce your risk of getting it, perhaps. There still is not a time yet where we're all going to get back and go to the movies or go to the Hollywood Bowl together because there's still not enough vaccinated people. And if you are experiencing symptoms of COVID-19, remember, you can still get it. These vaccines are really good at reducing severe disease and death, but you can still get mild disease, even though that's much lower. So even if you've been vaccinated, if you've got the symptoms, you should go get tested because there's the possibility you've got it. And then you're going to have to stay away from other people because you can probably still spread it, although at a rate which is much less than it was before. So some of the things that haven't changed, as we just talked about, no big public gatherings. You shouldn't be traveling right now internationally if you don't need to. And you should get tested if you have symptoms. So these are the things that haven't changed. All right, so that's the vaccines. And this is going to change more and more over time because as more and more people in the community get vaccinated, you'll see, okay, now you can get together with slightly bigger groups. Okay, now we're going to be able to get together with 50 people, with 100 people. And so this will change as more and more people get vaccinated. And then the promised land, when everybody's vaccinated, it'll be like, okay, everybody back to your normal activities. That's going to take a while here in the US till at least probably the end of summer. And then for the rest of the world, at least until the end of the year. And we'll have some more data on that coming soon. The recovery trial. Okay, so this is, the recovery trial. It is a huge randomized trial with lots of different arms. Specifically, the recovery trial for colchicine has been paused, stopped for futility, basically. They've randomized over 11,000 patients, over 2,000 deaths, and giving them colchicine versus no colchicine. There was no difference between the two groups, about a 20% mortality in each group. So they stopped the study. There was one study that showed maybe there was a tiny effect of colchicine. This one is far bigger and far better and showed no difference. There's probably some more colchicine studies coming, but for now, we don't think that colchicine is going to work. Then there's some MABs, baricitinib and remdesivir, combined together, this is a very controversial article which was published in the New England Journal that said the combination was better than placebo plus remdesivir. But the confidence intervals here are quite wide, and we're not exactly sure how much of benefit. But for now, the side effect profile is pretty good. And if you're in a high-risk group, some people are using this. But I'm still personally waiting for more data because only a small number of these patients, it turned out, were actually getting steroids. So how will the steroid effect work in there? So don't exactly know. This is more for the intensivists, not so much for the ER people. And then lastly, for now, the effect of ivermectin. There's been a lot of talk about ivermectin. Again, this is the same old thing again. If you take ivermectin and you drop it in a petri dish with COVID, you can show significant reduction in the replication of COVID. But is that the real world? Well, this is one of the first well-done double-blind randomized trials. 200 people in the ivermectin group, 200 people in the placebo group. These were patients who were symptomatic with mild disease. They treated them for 5 days, and they showed no difference between the two groups. This isn't definitive. There will be more studies. We'll continue to follow this. We'll continue to update you. But as we're getting these randomized trials, it's not looking like ivermectin is working. So these are just a few of the things that are occurring in the COVID world. They'll be into the textbook chapter in coming days. But the big thing now is if you've been asking the question, as so many people have, now the CDC has said, if you're a vaccinated family, you can take your mask off and act normally, and you can get together with one other unvaccinated group, family, and do the same thing. And as we get more and more people vaccinated, you're going to see these groups expand out further and further. All right, Herbert out, and more updates when they come. Thanks.